Good afternoon, Eddie. Thank you for joining me for today's update. We'll talk about a number of different matters today. I'm pleased to be joined by General Kendall Penn, as well as Secretary Romero and Secretary Johnny Key of Education. And I asked General Penn to be with me so that I could comment on the tour of the southwest border in the Texas area just this week. And I went there with General Penn to show support and to visit with our National Guard personnel who is there in the McAllen, Texas area to support Operation Lone Star, which is the mission of the state of Texas to work with the Border Patrol in providing greater security for our border. And first of all, I want to say what an incredible job our National Guard personnel are doing. They are working hard, they believe in the mission, and all of the other National Guard personnel there are talking about the critical role that our men and women in the service are rendering. They're providing mechanical support as the National Guard vehicles utilized for patrols. They do the mechanical and the technical work to support that mission. So we had a great visit with them. In addition, of course, I met with my former officials that were at the Department of Homeland Security, now Border Patrol, and we visited, got briefings from them, as well as the Texas Department of Public Safety. And then we had a personal view of the Rio Grande River and that valley there and the security issues that were involved in our nighttime patrol. And I think first point I would make is, again, of the importance of that mission and how our National Guard is supporting that in a very effective way. Secondly, there is a crisis at the border. It is a humanitarian crisis, it is a border security crisis, and it is a public health crisis all combined into one. And while at this time, in my judgment, there is not operational control of the border, that with the resources that are being put, particularly from the states, combined with what we have from the Border Patrol, they will make a difference. But ultimately, there has to be policy changes that are made, that were reversed this last January, that puts the entire security of the border at risk. And there's going to have to be policy changes made before we can regain that operational control that is so critical. If you just look at the seizures, it's never been worse than it is right now in terms of our border security. I look back 20 years ago when I worked the border and where we are today, and it was bad 20 years ago, but the apprehensions, the seizures of drugs, all are far beyond what we've ever seen before in the southwest border region, particularly in Texas, that has the most recent vulnerability. General Penn, did you have a comment?
Thank you, Governor. And so, as you probably remember, these were the soldiers mobilized under state active duty orders, primarily from the Fort Smith area. They are mechanics by trade. They are down there at in McAllen right now doing their military mission in support of the Texas National Guard, also in a state active duty status. Their morale is high, their work is excellent, and they've got nothing but accolades from the folks that they're supporting down there. I think it was a great opportunity for us, and we appreciate being able to support our neighbors to the southwest.
Thank you, General Penn. And with that, let me go to our case report for today. And you'll see, I think I got ahead of our video that was playing, but you'll see in our case report that our new cases are 882, and this is down from a week ago once again. So our trend line continues. It's down about 300. Active cases are down. Very sad anytime that we lose our Kansans. but as you can see, that number is down from what it's been as well. Next, you'll see the doses that have been given out of our vaccine, which is 10,000 doses given out, and the fully immunized is increased by 3,100. If you break down the 10,000 doses given, about 50% of those have roughly been booster doses in recent weeks. That trend is continuing to stay the same. About 28% of those are first doses, which, 2,500 to 3,000 is about what we've been running on first doses. Obviously, we'd like to see that increased, but we're gradually getting there. We're just not completely there yet in terms of where we need to be. Then you'll see the hospitalizations down by 40, ventilators down by 15. Continued good news. And then the trend line, I like to show this so that you can see the comparison of where we are right now in our cases versus where we were from March to about June when we started going up. And so we're still not down to that level yet. The next, you'll see what I always like to show as a reminder that when we see deaths in our Arkansas hospitals and we report them daily, on the right side you'll see that only 11% of the deaths are those who have been vaccinated. 89.9 or 90% of the deaths that we see are those that are not vaccinated. And the same thing is true percentage-wise for hospitalizations and our cases. Vaccination is the best opportunity to not get infected, to stay out of the hospital, and to reduce the chance of death. With that, we see the percent that's fully and partially vaccinated. You combine those two numbers and you get over 64% of Arkansans, eligible Arkansans, have been vaccinated. And then we see the positivity rate continues to go down. Our positivity rate is 7.9%, combined PCR and antigen. I like that, getting it down below the 10%, but we hopefully will continue to see that improved. And then I'm going to ask Dr. Romero to come and talk about pediatric hospitalizations. That is a reminder of the seriousness of this Delta variant and the impact that it can have on young people, and the reason we need to keep our schools safe, as well as pay attention to this in terms of our young people. Dr. Romero.
Thank you, Governor. I want to present some data that the Health Department has put together and presented at a national meeting last week. And the purpose of this is to really dispel some of the myths that this is a benign disease in childhood. What we are seeing is that from the peak that we saw in the winter months to the peak to today, recently finished, we saw an 84.4% rise in hospitalization. So a statistically significant number. Next slide. This is the ICU admissions by month. And so what you're seeing here also is a 22% increase from January to August, and then a significant increase of 63.6% from January to July. Overall, it didn't reach statistically significant values, but it tells you that we're seeing more kids going into the intensive care unit. And we have data showing that those children are requiring more ventilator use than in the past. So I want parents to understand that there is vaccine available for those individuals ages 12 and 8 to 18. That is the way to prevent this type of admission. That this disease does have significant ramifications, and please take advantage of it. It's also the reason why we're recommending masking in school and quarantining in school, because we want to prevent the transmission of this virus to those very susceptible individuals, and more so for those children under 12 years of age who we do not have a vaccine for. So thank you very much. Thank you, Governor.
Thank you, Dr. Romero. And then before I ask Secretary DeKey to come up, I wanted to reemphasize what we are doing to reduce quarantines in our public schools. We, as I announced last week, have a number of different protocols in place that, if followed and the schools succeed, can reduce the quarantines in the schools by the students. Mask wearing is one of them. Vaccination rates is another one. And if the students are vaccinated, you can avoid quarantine. But in addition, we set a goal if a school is 70% vaccinated in the community, then with reaching that goal, you can avoid quarantines. We also have, as I announced, a pilot program, Test to Stay, which means that if you're exposed, you can be tested on a regular basis and not be quarantined as long as that test returns negative. And we have a number of larger schools that are participating in this. The 4 pilot schools are Russellville, Springdale, Cabot, and Bentonville. So I applaud those schools for looking at this and working with our Department of Health and our Department of Education to give another option to keep kids in the classroom, avoid quarantine, but to do it in a safe way, and that's what we're trying to accomplish. And Secretary Key, I know you have a couple other comments to make, but I invite you to the podium.
Good afternoon. Thank you, Governor. And with those pilot districts that we're working with, we'll be working with them for 2 weeks. And in those 2 weeks, we'll be looking at their data and determining how to roll that out, working with Dr. Romero and his team to determine how we want to scale that to other districts that choose to be a part of that. So we look forward to getting that information out to those districts today. As has been reported already this week in our K-12 public schools, we are now right about 1,600 cases, active cases. We are seeing our cases in our higher ed institutions now dipping below 200. So we are very encouraged that the trends are going in the right direction. We're having a successful school year, but the effort that it is taking by our administrators, our teachers, and our support staff in our schools is extraordinary. It's taking an extraordinary amount of mental energy, emotional energy, and physical energy. And we're getting feedback from some teachers, and in some cases, some of the most positive people that I know telling me, we need help. Well, today we are promoting what is not a new program. It is an existing program that is part of the benefits package for all public school employees, regardless of what insurance program you're on, and that's the Employee Assistance Program. And through that program, counselors are available to you as a school employee and for members of your household up to the age of 26. We know that COVID has taken a toll not just on our educators, but also on their families. We will have this information out on our social media, and we would encourage, if this is something that you feel like as an educator or as a member of support staff or administrator in a public school, if you need to talk to someone, this is a way that you can access this free of charge. It will be completely confidential, and we want to stress that your mental health is important to us. It is important to your students. And for us to continue to have a successful school year, we want to make sure you get the assistance you need. So please look to our social media pages for more information.
Thank you, Johnny. And with that, we'll be happy to take any questions.
Are there any schools that did meet the 70% vaccination requirement?
There has been one private or charter school that has reached a 70% vaccination rate. That's the only one that I'm aware of.
I wanted to talk about Afghan refugees. How many are we planning to get? I know there's some that are expected in Little Rock within a week.
The information that I have is that we have been allocated 98 slots for Afghan refugees, approximately 49 in Little Rock, 49 in Northwest Arkansas, and the refugee resettlement agencies are working to be ready for them. I've had calls from employers that say we're ready to hire them, ready to give them a job whenever they get here. So we're just waiting till they actually arrive, and as you indicated, it should be soon, and that's the information that I have.
How many National Guard members do we have down there currently, and when are they coming home?
It's a 90-day deployment, and they should be coming home by the end of this month, and I'll let General Penn give exact numbers that we have.
Thank you, Governor. We have 11 National Guardsmen down in Texas right now, and we expect they will be back home and released by the 24th of this month.
And given the fact that you described this as a crisis, why aren't you extending?
Of course, we're responding to an EMAC request from the state of Texas that asked for resources, and we've provided these to them, and they ask them for 90 days. If they make an additional request, we will evaluate it, but we don't have any additional requests on the table. One thing that I learned there is that the Texas National Guard is beefing up their deployment, and so within that state, they're going to have an additional 1,000 or more that will be deployed, and so we were filling the gap until their resources can be deployed there along the border. So we'll wait and see if we have an application for additional assistance, but this time there is not.
What are your thoughts just on the current process and developments in redistricting?
The greatest responsibility for congressional redistricting falls on the legislature. They're working on that, and my comment would be redistricting is the main point, if not the only point, of this extended general session. So let's concentrate on the main point and let's work hard to get it right. And I know they are doing that. In terms of the plans, obviously there's still a number of different plans being circulated and being worked. I think it's important to note that there's nothing wrong with dividing a county in order to achieve the right population requirements and the constitutional standards. You don't want to have much of a variance in your population in each district. And so the last time we had 5 or more counties divided, most of the plans have them divided, some of them, in order to meet those population requirements. What's important is not whether or not you divide Pulaski County, but how you divide Pulaski County if you make that decision to do so. And it needs to, I would urge them to keep in mind that you do not want to dilute minority representation or influence in congressional races. And that is an important factor, I believe, that should be considered.
And I know that another bill that was discussed, 730, about unemployment benefits for people who may be fired for vaccination status. I was wondering your thoughts on that as well.
Well, there's 2 bills it looks like has passed in some version, the House and the Senate. The emergency clause is not passed, and so it appears that it will come to my desk, and I will make a decision whenever it gets here. I've expressed reservations about the bill because I don't believe in a federal mandate on vaccination, but I also don't believe in state mandates as well on employers and defining the employer-employee relationship and what employers can and cannot do in terms of the public health. So I have reservations about the bill that was passed. I worry about the burden that it places on employers. Obviously, they're trying to address some assistance to the workers, but I don't want to overly interfere and create mandates on our business. The test to me is what's going to be the impact if the emergency clause is not passed over the next 90 days. I intend to talk to the Department of Labor that is going to be coming down with their own guidelines based upon the President's vaccine mandate. I want to see how that's going to fit and whether the employers are going to be caught in a bind between the federal requirements and what the state law may require. So I've got some work to do in those communications just to learn more as to whether that bill is manageable and whether it places an undue burden on the businesses that would be unacceptable.
You're referring to the Federal Department of Labor?
Yes,
Okay.
yes. Are there any, excuse me,
So, it's pretty easy to overturn a veto. Is it likely you're just going to let the bill become law without your signature?
that is another option, but I'll just have to wait and see. I've got some more work to do to make that decision. Are there any questions remotely?
Yeah, Governor, this is Andrew with AP. Wanted to follow up on redistricting. The issue you talked about with diluting minority representation. Is that a concern from the map that you've seen on the two bills, the identical bills that the House and Senate are considering? Have you taken a close look at that to see if that proposal kind of passes that test for you?
It causes me some concern of what I've seen thus far. I haven't looked at all of the demographic details for how those districts wind up, but I've heard some of the comments by Central Arkansas legislators expressing a concern as to how the minority population is fractured into different congressional districts. So I just want to look at that more closely, as I hope the General Assembly will look at it more closely as well. Anything else? With that, thank you all very much. Great to see you today.